Hello and welcome, folks, to our video lecture on treatment modalities, part 2. This video is going to focus on specific medications used in medication-assisted treatment. We will discuss buprenorphine, methadone, as well as naltrexone. So buprenorphine is also often known by its brand name, Suboxone, which is not purely buprenorphine alone. It's also combined in the Suboxone brand with naltrexone. So what Suboxone does when a person takes this for medication-assisted treatment is that part of the Suboxone, the buprenorphine, will fill the opioid receptors and mitigate the withdrawal effects. So while a person is, for example, detoxing from heroin, if they take Suboxone during this process, the Suboxone will partially fill the opioid receptors that are now craving, that are now in need of, because they're physically dependent, they've become chemically tolerant upon the heroin. So the Suboxone is substituting for the heroin so that this person doesn't experience the painful and debilitating withdrawals associated with things like heroin, morphine, and other types of opiates, including oxycodone, for example. And then the other part, because it is a blocker in Suboxone, so part of the Suboxone will fill the opioid receptors with the synthetic opioids, and the other portion of the Suboxone will block the other opiate receptors from being filled. So this will allow for a person to need less and less of the synthetic opioid over time in order to prevent the withdrawals. So methadone also functions in a similar fashion, although methadone does not have an agonist along with it, although it does work at a weaker intensity than other opiates do, such as heroin and morphine and oxycodone. And so both of these substances, the theory is that these two substances, these medications, are filling the opioid receptors with a much more mild form of an opioid. And with the Suboxone, again, it has the partial blocker in it, so it's also blocking some of the receptors, so kind of these receptors then that aren't getting filled over time can kind of die off. And while a person is taking these medications, they're also provided with behavioral therapies. So in particular clinics, they're assigned a counselor who meets with them at least once a month throughout their recovery process, which can take anywhere from minimum of 2 years to some clients are still prescribed methadone and Suboxone for opioid use disorder, 10 years later after their initial treatment. So some people believe that once on these substances, a person needs to maintain being on these substances for long periods of time, in some cases the duration of their life. Other physicians and counselors would argue that a person can successfully detox from Suboxone and methadone and live a sober life without either of these substances. And again, it depends on the person, it depends on all of the individual factors that come when you're treating individuals with their own unique set of circumstances and their own unique set of triggers and traumas and stressors and life circumstances. So how is this helpful? Why would we want to replace an opioid with a weaker opioid? The person would still be physically dependent, right? So technically, yes, there still would be a level of physical dependency. However, as we have seen through some of our other research that we've done together throughout this course, people often avoid coming off of an opioid because of the withdrawal symptoms. And this process of using and becoming very high on the substance, then withdrawing and coming down, trying to find the next fix and to get high again, this often will leave a person's life in shambles. So they're starting from the ground up, even with their basic necessities like food, clothing, and shelter, as well as other types of medical care, not to mention if there are legal issues involved in this person's addiction. So while they're taking the methadone and Suboxone, then they're able to receive the behavioral therapy, they're able to receive the medical treatment, they're able to get a job and maintain it, they're able to take care of their legal issues. So the medication functions to help a person function. And then over time, as the client has built up a set of coping mechanisms, tools, as a person has been able to work through some of the underlying issues that have contributed to their addiction over time, then the person is able to, with the assistance of medical personnel, taper or wean off of a medication. So whereas they may have been holding steady for 2 years at 100 milligrams of methadone, now, 3 years into the program, they feel ready to come down. And so the doctor or the nurse will then prescribe them a taper, whereas each week they may go down 5 milligrams of methadone until they're down to a dose where the person has the option of saying, I can't go any lower than this, I'm feeling sick, I'm having cravings again, I need to stay steady at 35 milligrams. And then a person can stay steady at 35 milligrams until they feel ready to taper off. It would function the same with the Suboxone, which in medication-assisted treatment is in a film, and the methadone is in a liquid, whereas when used for pain relief, buprenorphine and methadone can also be found in the tablet form. When tapering off of Suboxone, the milligrams would be different. A person may be steady at 10 or 12 milligrams and only taper down 1 milligram per month, for example, until they are able to successfully get to 0 and maintain abstinence at that level. So another substance that is used, another medication used in medication-assisted treatment is naltrexone, which is a complete blocker and is often known by its brand name Vivitrol, which is used in an extended release injectable format. So this is often used for people who feel able to completely abstain, because if they drink alcohol or use opiates while on Vivitrol, they would become very, very sick. And so all of these substances, all of these medications are also used in correctional facilities for people who have substance use disorders while being incarcerated. If you have any questions about these substances, please review the links provided in the Moodle website, and feel free to reach out to me through email, as well as through our live question and answer next week. Thanks very much. Hope you learned something new.